create possible. Together we create possible.
Welcome to Young Epilepsy's podcast, where we discuss topics that are important to young people and children living with epilepsy. We offer information and tools that will help them in everyday life and support their families, friends, and health and education professionals who care for them. I'm your host, Kirsten McHale, and I'm the epilepsy nurse consultant and head of health at Young Epilepsy. Welcome to our podcast episode today, where we are going to be discussing understanding different seizure types. We're here to help you understand different types of seizures and how they can affect our young people. In this episode, we'll cover different seizures, we'll talk about medical, emotional and social impacts, we'll share some personal stories and some expert insight, and we'll have some practical advice on managing seizures and providing seizure first aid. We'll also address some common myths and misconceptions as well surrounding epilepsy and specific seizures. Today, I'm going to be joined by Alex and Olivia, and I'm delighted to let them introduce themselves. Olivia, if you would like to go first.
Hi, I'm Olivia, and I've had epilepsy for 9 years. I've had absence epilepsy and also generalised epilepsy. And I'm 20 years of age and a elite triathlete.
And you're, say that again?
Elite triathlete.
Oh my God, are you really?
Yeah.
Can I ask a question? Which one is the triathlete? So is that the one with horse riding, or is that
Swim, bike, run.
swim, bike, run? Cool.
Yeah.
Thank you. I always get that and then pentathlon
Oh, yeah.
confused.
Because it's like the on at the end. The
Yeah.
Triathlon, pentathlon, decathlon.
Yeah.
You're a legend already, then. You don't need to be doing any podcasts. That's incredible. Well,
That's right.
wow. Thank you, Olivia. We will elaborate much more on that as we cut through the podcast. Alex?
Hi, so I'm Alex Cox. I am a youth support coordinator at Young Epilepsy. So that means I work with our youth support service in supporting young people, providing one-to-one mentoring and support, and organising groups and events around supporting families and young people with epilepsy.
And Alex, how long have you worked at Young Epilepsy for?
Oh my gosh, a very, very long time. Basically probably over 15 years now, so it's been a while. Not in the same role, like in doing different things and different bits and pieces, but yeah, doing the kind of outreach kind of support side of things, probably about 7 or 8 years now.
But
Blimey.
you've done various roles.
Oh yeah,
throughout
yeah, definitely. Yeah, no, it's been a lot.
It's been a lot. Brilliant. Well, whether you're a young person with epilepsy, a parent or a carer, this episode is for you. So let's get started. Alex, would you mind explaining a little bit to me about your experiences as a youth support coordinator with young people who have epilepsy and how it affects them?
Right, yeah. So the impact of epilepsy on the lives of young people, from our perspective, there's a lot, all right? A lot of people think about seizures. So when I talk to schools, when I speak to families, a lot of the first reaction is thinking about like, okay, what happens when someone has a seizure? And obviously that is a priority. You've got to think about the first aid side of it and looking after, as we're going to kind of discuss today. But there's also so much more around that, because we've also got to think about how, someone with epilepsy is going to feel, right? There can be a lot of anxiety about seizures. There can be anxiety around medication. Sometimes medication itself can actually have side effects and can impact on a young person in some ways. It can have a real impact on education in terms of their academic performance can be affected. There's a lot of ways in which, seizures in general can impact on people's lives. I mean, one of the big ones we see is attendance at school, right? If somebody's having a high frequency of seizures, and then they're having to take days off because they haven't slept at night, particularly with nocturnal seizures, a lot of schools now put a lot of pressure on young people to attend. So if their attendance drops below 60, 70%, a lot of schools, jump on that. And we have to kind of sometimes argue a little bit about, well, actually, no, there's a reason for this. There's a reason why this young person's not making it in. But yeah, in the one-to-one stuff, the big thing I generally see is the emotional kind of impact of seizures, really, and how it affects someone's confidence, their self-image. Do you know what I mean?
Yeah, 100%. Yeah. I think for me, when I got diagnosed, it's probably just a bit confusing. And I think confidence-wise, like you mentioned, I think my confidence probably declined a little bit.
Because nobody wants that diagnosis, do you? Nobody wants to go, oh, hold on, here's that label I've got now. And do I really understand what these doctors and nurses are telling me? They use really long, convoluted words that people don't understand.
Yeah, I was only 12 at the time and I just had no idea what was going on. And like my parents didn't know what was going on. I think as well, like triathlon was my whole image. And then,
So you were super sporty
yeah.
from a small child?
Yeah, pretty much. But that didn't come from my parents. That was just from me. Like, you know, that was my image. And the whole school, like, knew me for being this triathlete, this sporty person. And then all of a sudden, I just got diagnosed with something that I thought would be really limiting.
So tell me about your first seizure. Tell me when this first happened to you. What did it look like? What happened?
I was about 11 and I started having these absences. So we went to the doctors and they just told me it was puberty. I was just daydreaming.
So the GP? You went to
Yeah,
the
just the GP. So it went undiagnosed for about 6 months, and then I'd be running, I'd be cycling, I was having these absences, which is obviously it's really dangerous.
Definitely.
I'd go out running with my dad, and I'd just all of a sudden be in the middle of the road.
Oh.
So my mum took me back to the doctors, and she was like, "This is not puberty. This is something more serious." So they took me straight away to for a scan. And immediately on the way home, I got a phone call and they were like, "This absence epilepsy." So I went about 5 years with that. And then I had and it was all under control, you know, I didn't have an absence. And then I was weaning off.
Take medications?
Yeah, I was on ethosuximide. And then I was weaning off my tablets and I was on my last week of my last tablet and I had my first tonic-clonic seizure.
Oh, how disappointing for you.
Yeah. But then I feel like as well, you know, it was difficult because obviously I didn't know how that was going to impact me. But
Did you get a diagnosis, Olivia? Did they give you a formal diagnosis that had a name to anything?
it was just absence epilepsy and generalized epilepsy, and they don't know where it came from. They don't. It's not genetic. So that's all.
So once you had absolutely. Once you had your big generalized tonic-clonic seizure, how did that make you feel?
I was just a bit confused, to be honest, but then at the same time, it sounds bad, but then it was also a bit of a relief because that's what epilepsy is. So I felt guilty because it was like, oh, you know, I've had a seizure, like that's what epilepsy is. And now I can, you know, tell people that I've had a seizure and they'll believe me that I actually have epilepsy. People always thought I was faking it.
Yeah.
So I feel like it was a bit of a relief that I'd had one in effect. But then it kind of got worse and worse, but my performance never declined. You know, it's difficult because obviously you have side effects, and that makes your training harder. But then performance-wise, I did everything I needed to do. It's just the coaches that made it difficult because of the discrimination that I went through.
That's awful.
That is awful. Tell us a bit about. Would you mind sharing that with us? Because I think this is something that, especially from my point of view and yours, Alex, that we see with young people that are too frightened to tell people that they. The amount of children that I know on my caseloads in the past that you diagnose them and they'd say, "You don't have to tell my school, do you? You don't have to tell anybody. I don't want to tell anybody."
So sad.
And a massive part of what Alex does is trying to bring young people together, not necessarily to talk about epilepsy, that can come down the line, but it's about breaking down those stigma barriers, isn't it?
It's so important to tell people around you. Like I immediately, as soon as I went to university, so I'm at Loughborough, and as soon as I went to university in 2022, the first thing I did was tell my coaches because I want them to know what to do in that scenario. And obviously for triathlon, you swim in the morning, you know, you swim early in the morning. And if you're a swimmer, you'd know that. But it's at like 5:30 and I cannot swim at that time. It's too early. So I asked if I could swim later. And initially they were supportive and they were like, yeah, that's fine. But then they stopped supporting me with that. And we had to get loads of external people in to speak to them. And it was... especially with, you know, when I'd had a seizure, you know, I had to be the one that would tell them what to do. I had to be the one that would go over to the pool or go over to the training session and explain. You know, I'd have like black eyes or like bruised nose and stuff. And I was the one that was going over with like this seizure fog and explaining to them the next steps. And it was just painful. And it was just so bad that they just would not support me with that. You know, I did PowerPoints for them. I sat them down and explained everything and they just would not take on board the feedback. And it's, you know, it doesn't matter how much you do sometimes, like they just won't listen.
I think that's so difficult to talk about, Olivia, and I'm really grateful that you're sharing your story with us because it's so hard for people who listen to these podcasts who are probably going through something very similar.
Yeah.
You almost want to empower people to share, to be honest, to be open, but actually that in turn causes discrimination and people treat you differently.
Oh, 100%. I mean, I wish that was less common, but in the young people we work with and the young people we support, it frequently comes up, you know. I mean, I mentioned at the beginning, like stuff around misunderstandings around attendance and things like that, and a lack of understanding. I thought what you were saying actually about the absence seizures versus the tonic-clonic, really interesting, that you said that it felt like this was finally a real seizure, because I think that there's a lot of confusion around sort of seizure types and the way that epilepsy can present.
Definitely.
I think in the media, like people maybe have seen representations of like tonic-clonic kind of seizures.
That's the only one they see.
Right.
Flashing lights.
Yeah.
And so like people are like, naturally that's it, that's the extent of their knowledge, and it can be really difficult, right, in terms of like schools to recognize that, or universities or other, you know, employers, all different kinds of groups, right, to recognize and really understand like what's happening. Yeah,
I think it's incredibly difficult, and I think that's why, you know, we do the jobs that we do to help and support and to raise awareness so that we can help and support schools and families and the wider community. I mean, so much of my job is trying to raise awareness, but again, you're met with frustrations because schools don't have the resources, colleges, universities, they don't have the resources. So we can say, oh, you know, we would like you to do this, 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 and this to support that young person, but realistically, have they got the extra staff to do that? You know, it was usually always met with, you need an EHCP, you've got to have more, you know, special needs, you've got to. So for young people who are in the mainstream world, I think that makes it.
I think as well, like, I obviously moved away from home and I'd never been alone at university. And even the GP at my university was awful. They just stopped prescribing me my medication. So I went about a month with no medication.
Wow.
And we had to, I had to put in complaint after complaint with my GP because it was just so frustrating. And I spoke to my coaches as well, and I was like I can't train because I've got no medication. And
what medication did they put you on once? So you come off the ethosuximide for the absences, because ethosuximide is only for absences, doesn't cover any other.
Well, I've still got absence epilepsy, so I'm still on that now.
Still on
the highest dose. And then I'm on lacosamide and perampanel. But I am actually coming off perampanel. So I'm currently going through a medication change because I'm going on Epilin. But again, like, that's something that I will tell the coaches and they won't understand, because obviously when you're going through a medication change, it has such a toll on your body.
Of course. And perampanel, it's one of the side effects for that is ataxia. It makes you wobbly. It's why I prescribe it and give it at night time, because actually it can make you very dizzy if you take it early in the morning. Most epilepsy meds, we know you take twice a day, every day, after your breakfast, after your dinner. But then with these types of drugs that can cause you to feel dizzy and feel wobbly and feel nauseous a lot of the time, then they're no good.
Yeah, I mean, I take that perampanel overnight, and the first time I took it, I was floored. I was so bad. I was on the floor every night. I'd try and get to the bathroom, and I would just be on the floor. My boyfriend had to, like, help me, and, you know, it was almost like I was having a conscious seizure. I was fully aware of what was going on, but I just had no control. And, you know, and again, like, I'd explain this to the coaches. I'd be like, I cannot train in the morning because I've been up all night.
You're exhausted.
Yeah, and my boyfriend's been trying to get me off the floor back onto the bed, and they read the message and they just bat it away. It was, as much as I tried to explain this, they just would not take it on board. And it's so sad, because I was doing as much as I could to try and help them understand, and they just they just don't take it on board.
And do you think that would have been quite a catalyst for some people to quit, to give up, to stop doing?
100%, yeah. And I think sometimes that goes through my head, because, you know, I've not had any support at the university. I've had nothing. And I think sometimes you just get these thoughts and you're like, can I even be bothered anymore? It's so difficult, especially with epilepsy, like, alone, without the discrimination. It's like, it's just so tiring, like, it's so difficult. But then at the same time, it's, you know, this is what I enjoy doing, and I should not let epilepsy stop me. So I keep doing it, but I don't apply pressure to myself, because applying pressure, then you don't enjoy it, and then, you know, you kind of, epilepsy takes over you a little bit, I think.
And it can be everything, can't it? It can be all you think about from the moment you wake up in the morning till the moment you go to bed at night. And if you haven't got a strong support network and people aren't hearing you and supporting you, that is a lonely road to be on.
It's really lonely, 100%.
I think that's something we hear a lot in the support service. Is the number one thing we hear from young people is they feel like they're on their own. They feel like they're the only one in the whole world who's facing these kind of challenges, and they have to face it alone. And I think I totally hear what you're saying. I can totally empathise with where you're coming from, because I think that is the number one thing I would like to see change, and that's what I hope from the work that Young Epilepsy does and the support service does, that we can kind of change a little bit, or at least help some people to, you know, find a community of people around them and find support. Because that cycle you kind of mentioned, you know, because I'm really in awe. By the way, I think you should be really proud that you continue to fight. Like, congratulations,
100%,
like that is amazing. You know,
so great,
without that
so
support,
great.
and you've kind of kept going, and you're not going to quit, and that's amazing. I think that's incredible. But it's a cycle like I kind of see a lot around, particularly like exam time. So you imagine young people like get diagnosed prior to GCSEs. They come into a GCSE or A-level type stuff, and they're coming up for exams. They get really, really stressed. The stress can often act as a trigger for seizures. Their seizure frequency increases. They might have med changes. All of that impacts. And then they're getting more and more stressed because they're not getting revision done or doing as well in their mocks or their exams as they want to do. And it's so hard to then kind of break that cycle. And again, a lot of, you know, there are some educational places, there's some schools, universities that are great, that are really across it. Like, I will say that. I'm not going to say it's everyone. But there are some that just don't get it at all.
They don't.
They just
Even
don't.
Families would ring me directly and go, what can we do? How can we? And I have to then, as the epilepsy nurse, look at the legalities around it and send schools information about children and young people can have extra time. There's allocations that you can have. You know, we've got all these other things built in to help and support you. You can have one-to-one rooms. You can have laptops. You can have scribes. You can have all of these things. But schools don't seem to want to embrace that. It is a really difficult situation to be in for families, because they're doing the fighting for that young person who sometimes just goes, you know what, I can't be bothered. I'm just not going to do any exams because I know I'm too stressed. I'm going to have more seizures. I had seizures the night before, and I've had plenty of schools that have gone, well, they missed those exams, they can't resit them. And you think, how can we say that nowadays for our young people? We've got to give them every opportunity. If you had a sickness bug and you couldn't come in for whatever reason because the schools say you can't come in for 48 hours if you've got a vomiting bug, then maybe that would be rearranged for them. But you can't come in because you've had seizures, and I think it's a very difficult situation to be in.
100%.
So, Alex, there must be a memorable time for you in your career of supporting young people, either positive or negative, that has something that sticks with you.
There is a lot of moments that kind of stick for me. I mean, I remember one time being with a young man, 18 years of age, in the cinema, and him having a full-blown tonic-clonic seizure, and having to administer emergency medication, having to use buccal in the dark, you know.
Yeah.
And this was before, you know, like nowadays with the emergency meds, you tend to have pre-measured syringes, whereas you had a bottle and you have to sit there and sitting there with a torch during a film, drawing it up, ready to kind of administer. And it's just, that's the reality, is it can be really challenging because these things, you know, there's never an ideal time, right, for someone to have a seizure, but it's always these kind of moments where it's really difficult, and then members of the public kind of trying to get involved, like everyone has an opinion or want to watch what you're doing, and that can be really difficult. And you've got to think as well, when you're doing something like that, about protecting that person's dignity. Yeah. You know, because I can't imagine what it must be like to come around for tonic-clonic seizure and you've got people around you, and, you know, particularly in a public space. Definitely. And that kind of brings me on to something else a little bit, right? We do see that a lot with young people. There's a lot of anxiety in schools, colleges, about having seizures in front of their friends, about feeling vulnerable. I mean, I think you touched on it a little bit, talking about the athletic side of it, and you seeing yourself, primarily identifying yourself by your sport, right, by your passion. Yeah. And then, you know, I think for a lot of young people that's the case, and then they have to come to terms with the fact that there's this condition that can leave them very vulnerable in front of the eyes of peers and friends. And how are my friends going to react to that? How are random people, you know, around me going to react to that? And that again leads to another thing, which is parents trying to protect the kids and then holding them back. And yes, sometimes there are times when you've got to, you know, keep someone safe, and there's maybe certain things you think about and you risk this and you say, okay, maybe we do this way or whatever. But how do you then get people to get independence, if they're having frequent seizures, and everyone's kind of concerned about that because they need to get out and have, normal growing up stuff. You think about teenagers growing up and their lives, they can't let the seizures get in the way.
I guess from a parent's point of view, that's the worst nightmare, is letting you have any independence, because since you were 9, 10, they've wanted to wrap you up, keep you safe. Any type of seizures, parents never sleep again. I think it comes to a point where if you say you want to go to university, probably inside your parents are thinking, we're so proud of you, but we're dying on the inside because we don't want to let you out of our sight. And I hear that a lot of the time. And also what I do hear a lot of the time is, I don't really know what tablets I take because my mum has always got them for me. It's suddenly you have to become a grown-up and do a lot of that yourself. And university is slightly different because you do usually have that GP on campus that you can get your medications from.
Yeah.
Or you stay with your own GP and then you make sure you get your medications at the right time. But I think, again, it's learning to be an adult and take your medications as prescribed without your mum or your dad going, have you taken your medications today?
Yeah.
Because that happens a lot.
Yeah, it does. It does. Yeah, I think for me especially, when I was at home, I was still pretty independent with my medication.
Did you take early responsibility for this, Olivia? Tell me you did. Tell me you took early responsibility.
I mean, I didn't put it in the box, but I took them.
Oh, well.
I was the one who put it in my mouth. No, but I think when I was at home, my parents didn't treat me any differently to anybody else, and they'd always push me to be independent and do things, and they didn't shelter me. Whereas I came to university and all of a sudden I was almost forbidden to do certain things. And then it was like I was mollycoddled at uni, and it was, I don't know. And then I think I've kind of put that on myself, and I'm like, oh, I can't do that because I've got epilepsy. And it's a bit sad, really, because when I was at home, I was always doing this, that, and the other. I was pushing myself, and I've come to uni, and it's like, oh, I shouldn't run that fast today, because what about if a seizure happens tomorrow?
Or what about social life? Should you not go out and have an evening out with your friends or have an alcoholic drink? We talk about alcohol and anti-seizure meds a lot. In life, it's a big part of my job is talking about, please don't drink too much alcohol whilst you're taking anti-seizure meds, because they don't really like each other.
No.
But then you also have to have a life, and that uni life, it's so important to develop and grow relationships and be a normal person without this label that people put on you.
I think, to be fair, I'm a very big oversharer. During Freshers Week.
We love that.
During Freshers Week, I didn't really drink. I'd just go out and I'd just enjoy the social. Everyone was there doing like shots and stuff, and I'd just be there watching them like, woo! So I wasn't really that bothered about, getting involved with the alcohol. It didn't bother me because I was just so energetic and excited anyway. And then, I just don't think you need alcohol to have a good time. And, everyone, I would tell people if they were like, oh, have a shot. I'd be like, I don't want one. Like, I've got epilepsy. I don't need it. And then they'd be like, oh, right, okay, fair enough. But then that would lead on to the conversation of, well, can you go clubbing? Can you go to the union tonight because of the flashing lights? And I'd be like, well, no, because I'm not photosensitive. And they'd be like, oh, right, okay. Well, I thought that's what epilepsy was. And then you obviously get onto that conversation. You don't know whether they're going to remember it in the morning because they're like fueled on alcohol.
So do you think it's important then, or let me phrase that another way, how important do you think it is in sharing your journey, your personal stories with other listeners and young people? How important do you think that is?
Massively. I honestly cannot get the point across enough. Like, I will share my story as much as I can, because I'm not ashamed of it. And as well, it's like, so many people don't know about it, and immediately as soon as I meet someone new, it's like, I'll be telling them a story and they'll be like, oh, that's because I've got epilepsy. And you shouldn't be ashamed of it, and you shouldn't feel guilty about it or anything like that. But I don't let it define me, but then I feel like I need to get the point across that I have epilepsy and I've achieved this.
Absolutely. and be so proud of what you've achieved. Even if you didn't have epilepsy, you could be so proud of what you do. But even to have epilepsy as well, with all the factors, the environmental factors that come with that, medication, seizures, side effects, life, you're doing an amazing job. I'm so in your awe. It's incredible. Going back to the flashing lights bit, though, I just want to touch on some myths and misconceptions that there are around epilepsy.
Yeah.
So one I always get asked as a nurse is, can you swallow your tongue when you have a seizure? And I go, absolutely not. You can't swallow your tongue. What tends to happen is someone lays on their back, they're having a seizure, they pull saliva in the back of their throat. It sounds like they're choking. But what really has happened is their tongue's flopped back and they're kind of blocking off their own airway. So seizure first aid, good seizure first aid for us is we don't move people in seizures, but we tip them slightly onto their side so their tongue can flop forward and whatever's in their mouth can come out of their mouth. So I often get asked about flashing lights. Can we go to the cinema? Can we do this? Can we do that? If we've got, and I actually say there's only a really small percentage of people who are genuinely photosensitive, only a small percentage. So, you know, it's about if you've been diagnosed with having photosensitivity. Alex, I bet you've heard some.
Oh my gosh, so many kind of myths. Yeah, the photosensitive one comes up a lot. The tongue thing I've definitely heard before. The one that's actually quite an interesting one that we've seen is there are some, you know, religious groups and communities that believe that epilepsy has something to do with evil spirits and like kind of demonic possession. And there's a lot of superstition and belief around epilepsy and a lot of fear because of the way that seizures kind of look. Like people believe it's like a kind of spiritual thing, or, you know, they really worry about that, which can lead to some negative practices. And I do know of, there has been churches in London that have actually promised to try and cure epilepsy via prayer or via kind of religious rituals and those kind of things. And they are, whether they're doing it like in bad faith, whether they genuinely believe that to be the case, they are exploiting families. And I think that can be really dangerous. So that is a really important myth to sort of think about, that it is a medical condition. But the one that comes up also as well that I say to a lot of kids when I do school assemblies, the number one thing when I do a school assembly is you can't catch it, right? Like, because that's the one that the little kids want to know. If they've got one of the little kids in like a primary school who's got epilepsy, you say, right, they've got this condition, but you can't catch it. It's not like a cold. Yeah, it's not contagious. Yeah.
I get another good one, which I really like, is, can my dog have epilepsy? I'm going, well, yes, of course. Anything that's got a brain can have. And they go, oh, are you sure? My dog can. Yes, your dog can. Fish can. Anything that's got a brain. So I think the misconception questions are always quite.
I've seen a couple of dogs and cats have seizures before. Yeah. And for some reason, people always want to ask me about it. So if a family member has a dog having a seizure, they're like, oh, you do stuff with epilepsy. What's going on? I'm like, I don't know. I'm not a vet. Why are you asking me about it?
Oh, my goodness, that's hilarious. But yes, animals can have seizures as well, which is great. But again, some of the medications we give to animals are exactly the same as the medications we give to humans to have.
I was going to say, is that a good time to maybe talk a little bit about the different types of seizures? Because we mentioned it, you know, when you were telling us a bit about your story and your diagnosis and everything, about how you obviously had absent seizures and then you had tonic-clonic seizures. Yeah. And obviously there's other types of seizures, such as focal seizures, which are very different because they're not the same as the kind of generalized seizures. Could you talk us through a little bit? Because I always want to know a little bit more about the difference between the different seizure types.
So your brain is super special and super complex, and we only really use a really small proportion of our brains. But our brain is made up with electrical signals, basically, and our brain communicates with the rest of our body with a nice controlled electrical impulses up and down our body the whole time. So I don't have to sit and think, Kirsten, take a breath because you talk really quickly, even though I do talk really quickly, but my brain is sending these signals up and down to my body the whole time. So my respiratory system's working, everything's working in a nice controlled manner. So when you have a seizure, you have too much electricity in your brain. Now, you could have too much electricity in one part of your brain, which we call a focal seizure, or across the whole of your brain, which we call a generalized seizure. Now, focal seizures are not life-threatening. They're unpleasant for that person because you can retain awareness, you can explain how you feel a lot of the time. You just can't articulate too well how you feel. You can just know that you don't feel great, and you might be able to tell somebody that you just don't feel great and you have a bit of a funny feeling. But you can also have focal seizures where you have impaired awareness. So it looks like you're doing something in a very odd situation, but you don't actually understand that you're doing something in a very odd situation. So if you drop something, for example, you think, oh, I'm going to go and pick that up. But those signals that should be in a nice controlled manner are a little bit confused. So you can't bend down to pick something up and you can't really explain to somebody how you feel. But these seizures aren't life-threatening. They're just unpleasant for that young person, for that person that has focal seizures. So if you have generalized seizures, now our generalized seizures summary are what we all talk about all the time. So absences, which is our loss of awareness for a few seconds, which are often confused for daydreaming. I used to get lots and lots of young people referred to me from GPs because they were in school and were looking out the window a lot of the time. Now, don't get me wrong, we all daydream when, something isn't that exciting. But actually, absent seizures, you are effectively unconscious for those 10, 15, 30 seconds, 45 seconds, and they can be incredibly dangerous. And you said it right at the beginning, you were running with your dad, and then you'd run off into the road because you wouldn't know what you were doing. But your body, as it goes into that seizure, just remembers the last thing that it was doing. So whether it was running, it would be running. If you were eating, you'd still carry on eating. But your eyes would be open, but you'd be effectively unconscious. So then you've got your tonics. So you've got your tonic seizures, which is just the muscles become stiff and rigid and the person will usually fall over, usually backwards. You can have an atonic seizure, which is a loss of all muscle tone. So if you were stood up, you'd lose muscle tone. So this is a generalized seizure across the whole of your brain super quickly. You'd lose tone and your whole body would collapse to the ground. You can have a generalized tonic-clonic seizure. Now, these are the ones we worry about the most. These ones are the most dangerous ones. This where your whole body falls to the floor and you rhythmically convulse. Now, we worry about these a lot, and this is why best practice for us is if we treat generalized seizures at 5 minutes of a convulsive seizure. So if you have emergency or rescue medicines, this is when we'd give them at 5 minutes of a convulsive seizure. Now, not everybody has emergency rescue medicines. You must have had a prolonged seizure, so anything over 5 minutes to have got those meds in the first place. And then you can have myoclonic seizures, so like little jerks. So you can have clusters of those, or they can come just on your arms or on your legs. So seizure types are really important that we get the right terminology down. And I think, Alex, you've probably worked with young people who still don't really understand.
100%. I mean, there's still a lot of people out there who use really outdated language to talk about seizures. And I think that people aren't really aware of the different types. And I don't think people have that kind of language to really talk about it. I mean, like we said at the beginning, it's only really the tonic-clonic seizures are literally the only type of seizure that people are aware of.
Definitely.
That and when we said about the photosensitive thing. So absent seizures fly under the radar. Sometimes focal seizures can fly under the radar. I mean, how people can react sometimes to a person having a focal seizure. I've had young people where members of the public have thought they were drunk or they were just behaving erratically. If you've got kids who have other, communication needs and things like that, it can be treated as a behavioural issue. Do you know what I mean? Because they can't explain what's happening. I had a young person one time who, when they had focal seizures, they just get up and try and get out and move. And, one time they were on a bus and they just started to try and get off the bus. And we had to sort of guide them back in and,
But actually, if you saw that as a passerby, you'd think, oh my goodness, what is happening here? And it's really frightening. I think it's frightening for that person that's having that seizure. And it actually can be quite frightening for people that are supporting or even witnessing what this looks like.
Yeah, but there's all kinds of things, aren't we? We know of young people who take their clothes off.
Absolutely.
And they have seizures. We've seen dualistic seizures where people start laughing.
Uncontrollably in a really inappropriate place sometimes, which actually draws a lot of attention to somebody.
Yeah. So I think it's really important. One thing I'd like to see from this podcast really is for people to learn a little bit more about the proper terminology and to differentiate the different seizure types a little bit more, because I think that would be really helpful. And I think when you have conversations with schools in terms of supporting a young person, having that language and that understanding would be really, really helpful.
Absolutely.
But what I tend to do when I'm working with when I meet a young person, a young adult for the first time, I'll sit down with them and I'll say, well, what do your seizures look like for you? Because we can talk about the type or if they have a specific syndrome or that kind of thing. But actually how it appears to them is perhaps the most useful thing for their friends, their family to know, because knowing that it might not look how people expect or that they might need particular support. Do you know what I mean? Like if it was a case where someone stands up and starts tripping or starts trying to get out of the room, like how do you react to that? And making it individualized, because there's so many different seizure types, right? I think bringing it to the individual level can be really, I don't know if you found that, like when you've had conversations about your seizures with friends and family and things.
Yeah, I mean, like I said, I'm a bit of an oversharer. So, you know, I will just lay it down on the table to like my friends and family. I'll just say it how it is. I think, I mean, the first seizure I ever had, it was just me and my younger sister, and she was about 6 at the time. Oh, maybe a bit older, but
Quite scary though.
yeah, she's like 6 years younger than me. So, I mean, I had this seizure, and obviously I'm an athlete, I eat a lot. So she starts munching my food, thinking that I'd react. But in the end, she left the house and she walked herself to school after she'd phoned, you know, my grandma, because both parents were at work. You know, they don't expect that to happen. But when I've come around from the seizure, I've ran out into the middle of the road because I don't know where she's gone. And it's just, you know, it's so dangerous. But talking about, you know, events like this and telling people like, well, this happened, like this is what epilepsy causes. It's dangerous sometimes. It's so important to get that point across.
Absolutely. Absolutely. I think you're absolutely right. I also know that we've got an awful lot of resources on our website, advice around different seizure types and what that looks like, because you're absolutely right, both of you. For everybody, you might have exactly the same diagnosis, but how your seizures are going to present is very different to how somebody else's are going to.
And I think as well, like sometimes I've had a lot of seizures in front of friends, and when I come around from a seizure and afterwards, a lot of people, I always get asked, do you want me to film it?
Okay.
A lot of the time. And I just think to myself, well, not really. It's not something that I want to see. You know, I've experienced that, and I know what's going on to an extent. And in all fairness, you know, you've watched it, and you know, it's quite, I mean, I don't know, but I can imagine it's pretty traumatic for them. But it's almost like they want me to go through that trauma again.
So that's a really interesting point, Olivia, because as an epilepsy nurse, I always say to families, can you film the video? Can you video the seizures for me? Because especially at the diagnosis point, at diagnosis, it's so important for clinicians, for people like me, to hear the story, to unpick the history, because how you get a diagnosis of epilepsy is by seeing somebody like me. You know, you sit in clinics with consultants with special interests, and we listen to the history, we listen to what's happened. So you might get an appointment to see me 6 weeks after you had your first seizure, and if you haven't videoed it or written anything down, trying to remember what happened 6 weeks ago is crazy for families, especially with a very stressful situation. So one of my questions all the time to families is, have you got any videos? And you know, nowadays people go, absolutely yes, but they always want the young person to either step out of the clinic room because they don't want to hear it. And a lot of the young people don't want to hear it. They don't want to see it. They don't want to witness what other people have witnessed. So there's a fine line, I think, for videoing. So from a diagnosis point of view, you've got to have 2 or more unprovoked seizures at least 24 hours apart to get a diagnosis of epilepsy. So by unprovoked, I mean there is no head injury, you weren't unwell in any other type of way. So if you have one seizure randomly 1 week, and then it's several weeks down the line you have another seizure very similar, there's no focus to it, you weren't poorly, you weren't, then by definition alone you almost have that diagnosis. But in pediatrics, in children, we're a little bit more laid back. We usually watch and wait for maybe the 3rd seizure, because we don't want to jump in aggressively with tests that you might not need or medicines that you might not need to be on. So we wait that little bit longer, because there are tests and investigations that help and support us, but usually it's done on a really good clinical history. So by listening to your parents tell us the story, we can usually put those pieces of that puzzle together ourselves and think, actually, that sounds very much like a seizure. That sounds like this could be a diagnosis of epilepsy, and the videos will help us look and go, absolutely, that's a seizure. Because parents often come to me with videos of behavioural outbursts or other things that look like seizures, or a fainting episode, for example, and I can look at it and go, absolutely, that's not a seizure at all. So it can reassure parents straight away. When we say, and the advice we give about filming seizures when you're a grown-up with a diagnosis, we don't want people filming you. No, that's not what we want. People shouldn't film you. It's an invasion of your privacy and dignity. And often it can be funny for them, but it's not funny for you. And that is, it's a message that we always say, please don't film people unless we've asked you specifically to get videos of your seizures. We wouldn't advise anybody films you.
See, if it's like a random, do you know what I mean? If it's somebody on the street, if you've had a seizure out and about in a community or on a bus or something, and then somebody just pulls out their phone and starts filming it, because that's the world we live in, isn't it? People do this sort of stuff, don't they? Like, they want to put it online or whatever.
Yeah. So when we talk about managing seizure first aid, I think it's for all three of us here, we'd manage it in similar but very different ways. I think are totally medical and down that line.
Yeah.
So how would you want people to help and support you, Olivia, if you're having a seizure? What would you want people to do for you?
Well, I often get asked it a lot, when I meet someone new or, someone's, new to dealing with my seizures. They're like, oh, what do I do? And I'm just like, well, phone out, time it, leave me to it, unless there's something in my mouth, or if I'm near anything, just put something behind my head. That's the only real thing that they can do, and everyone's pretty clued up on that, that's close to me. I think everyone's a bit nervous sometimes, because I give them these instructions and they're like, right, okay, we'll
feel under pressure a little bit. Yeah.
But I think that the big thing is dealing with side effects. I often find is a little bit worse, because sometimes, for example, I go swimming in the morning and I won't feel right, and I'll be trying, to swim and swim fast, and it's like I said earlier, swimming's early in the morning, and if I've not slept right and I've maybe taken that risk to go swimming, and nothing's communicating, for everything's a bit blur.
And then, have you ever had a seizure in the pool?
No, I've had an absence in the pool, but I've never had a seizure in the pool. But a couple of weeks ago, I had bad side effects in the morning, and I got out after 40 minutes because I just couldn't move anything. Like the body was not communicating. And I sat there on the poolside after because I was waiting to be taken back home, and I started, jolting a little bit. And I was completely out of it, and no one's witnessed that before, and everyone's trying to talk to me, but I don't want to be spoken to because I can't take it in. And I think I started jolting a little bit, and everyone got a bit scared almost, but it's nothing to be scared of. You've just got to reassure that person, and I didn't want people to be scared of what was going on. I just wanted them to kind of check in and then walk by.
Absolutely. That's so interesting.
Sometimes a case, I think, with some of the young people I've supported in schools, you need a safe space to kind of recover. So there's like a school medical room or a space or a quiet room or somewhere someone can go, because it can take quite a while, can't it? Particularly if you've had like a big tonic-clonic seizure or something, it can be absolutely wiped out. That's probably the rest of the day done, right?
100%.
So you need someone to go somewhere safe, and then when they're ready, maybe you can try and get someone home or what have you. For me, when I'm talking about seizure first aid, you mentioned having a seizure in the swimming pool. I've seen a couple of young people have seizures in the swimming pool. We've even worked with a couple of people who've been coming into our service who've had seizures in the water and have inhaled or aspirated quite a lot of water while having the seizure, which has been quite dangerous. Some of them have had to be resuscitated and things like that. Now, obviously, that's the worst case scenario. I don't want to make you obviously mad.
I had one in April. I had one in the bath. So now, as a bath bomb enthusiast, I'm actually banned from the bath.
Yes, it's showers only now, is it? Showers only. Well, look, the advice we always give out is try and shower rather than bath.
I always have someone in the house if I was to bath, but that was a bit traumatic. Not for me, but for my younger sister again. She's got really bad PTSD from all of that because she had to come in and hold my head. But she was really scared, and like I said, she's only 13 and she's holding my head while I'm obviously frailing around in the bath.
But how wonderful that she did do that.
She is
That's incredible. Yeah, she is a hero, absolutely. And I think siblings often get overlooked a little bit.
Massively. Massively.
I'm sure you see that a lot.
Oh, yeah, definitely. There's two things. The sibling thing, 100%. The impact on other kids in the family, huge, absolutely huge. And they often need as much support in terms of the emotional side of it. Because sometimes it's like, okay, what I hear from a lot of young people is they have a seizure, they don't really remember it. So it has an impact on them medically, it has an impact on their life. but they're not, like you said, you've not really seen it.
No, I'm
you know
not
what I mean? You're not the one
traumatised
who's seen
by
it.
it.
But the people in your life around you see that, and they sometimes struggle. And that's sometimes why parents get really protective, because they've seen someone have those seizures and how scary that can be. I mean, I want to just go back to one thing, because we were talking a little bit about swimming and like, you know,
Yeah.
keeping people safe in the pool. I mean, I talked about the worst case scenario, but like, obviously that is another myth about people with epilepsy not being able to go swimming.
Oh, 100%.
You know, like schools really
Yeah.
panic about this.
Yeah.
We
and,
hear it
you know,
all the time.
Exactly.
Yeah, all
but
the
with the
time.
appropriate support, you get someone in there, it's fine. Do you know what I mean?
Oh,
Like,
definitely. But do you know what, Alex? I think probably one of the top related questions I get in all of my clinics, the first letter I get from a GP was, can you see this young person? I've told them that they can't go swimming, they can't go horse riding, they can't go trampolining, they can't do anything at all.
I actually had that. Well, as soon as I got diagnosed with absence epilepsy, I was due to go on my first regional training camp. And I was over the moon. I was so excited. And as soon as I was diagnosed with this, one day before I was due to travel, we had a phone call from the coach and they were like, she can't go. We can't have someone like that on camp. So my mum's phoning up absolutely every doctor she'd get hold of. And luckily I was able to go, but I wasn't allowed to ride my bike. And if I was to swim, someone had to walk up and down the poolside with me, which is it's humiliating.
Yes, of
Yeah.
course. And it's discriminatory and it makes you stand out.
Yeah.
And nobody wants to
And
be...
I was the youngest person there, and I was with all of these top triathletes, and it was just so embarrassing for me, especially when that it's a 25-meter pool, and there's lifeguards, and there's about 40 athletes there that could all swim.
Absolutely.
And obviously they may not be able to deal with seizures and whatnot, but I was on medication, had absence epilepsy, but
it's hard. So the advice I always give out is, of course, everybody with epilepsy can do absolutely everything.
Yeah,
as long as you let the lifeguard know, or you go with a competent swimmer, do swimming, climbing,
Yeah.
you name it, we do it, as long as it is safe to do so, and you've got someone with you who knows what to do if there was a seizure.
Yeah.
We say don't cycle on main roads if you've got absences if possible, but cycle pathways, places that are safe. But it's about leading a perfectly normal life as possible, just with a few lifestyle tweaks. And one of my big ones is don't bath, please. Have a shower. And I often say to your parents, everyone's on a water meter nowadays anyway, it's expensive to have a bath, have a shower, and then what's it cheaper? But from a safety point of view, it is better to have a shower. But I guess it's impacted on your life, but you've done the best that you can with it and made those adaptations yourself without actually having people help and support you, or from your university support you. So you've literally just trailblazed it, I feel, and just got very
much.
which you should be super proud of. So I think we all see it in different aspects. That you see it, you're living it. I see it from a medical point of view, families in clinics, and Alex, you see it in the work that you do in the community.
100%. I mean, I think it's another thing to think about with the you said about like training camps and things. One thing we see a lot is kids not being allowed to go on residential trips, and being able. The two big ones, and again, this comes up in our youth club and our support group all of the time, is like parents having to go with kids on residential trips, which is unnecessary. It's
Day
just
trips.
Yeah.
School day trips.
Because for some reason the school just panic. Either the school's just too chilled about it and they don't really do anything, or we get the exact opposite problem where they panic and the parent gets called in every 5 minutes, or they have to come along with everything. And that is an absolute kind of nightmare, really. It's funny, like with a lot of thought, like we said, you can do anything with epilepsy. You brought up climbing. I took a group of kids out on a climbing wall, and you're roped on when you're climbing.
Yeah.
If someone has a seizure, like halfway up, you just lower them down on the rope. It's absolutely fine. It's pretty much one of the safest sports you can do. You're wearing a helmet. You're wearing everything. Do you know what I mean? What you think's going to happen? That's fine.
It's when I've done lots of days out with young people on my caseload over the years, and my very first big summer event I went to Go Ape. Yeah. And I rang them and I said, I've done a risk assessment. I've got 30 children with epilepsy. And I was met with, you've got 30 epileptic children. No, I said, I've got 30 children with epilepsy that are coming, but there's plenty of medical support that are coming, and they're going to be in harnesses. This is the safest activity that these young people can do. So I'm such an advocate for everybody leading a perfectly normal life as possible, just with a few lifestyle tweaks. And I think that's what we try to promote as much as possible.
100%. Yeah, that's definitely the conversation I try and have with my young people as well, really. As far as it's possible,
Definitely.
But we do have a lot of resources available on our website to help and support education, schools, colleges, universities. So we do have resources for us. But Olivia, is there anything that you can think of that you think, God, I wish I'd had that or known that or can signpost people to now?
I think at the time it was probably the link to mental health for me, because I didn't know how much it would impact my mental health and the side effects, I think, as well. Like, I didn't know how much of a big impact that would have on me.
And did you get any help from mental health?
No. I didn't. I had to go about that privately. And I think as well with the side effects, when I first got diagnosed with my absence epilepsy, I read it, and then I think a lot of them were probably placebo in my head, and I'd make up things. I'd be like, oh, I probably got the hiccups today because that's side effects.
Yes, of course. Because if you read those leaflets, you can get a zillion side effects to everything.
Whereas now, I take all of my medication out the box and I bin the box straight away. So I have them all in in a box, like all
In a little dotted box.
all neatly organised. So I did never read any of the side effects for any medication. But I wish that I'd have been clued up on what the side effects almost do, if you know what I mean. And
I think that's a really big part of an epilepsy nurse's job, that we are there to try and bridge that gap and have those conversations with you, because the consultants, we're all time pressured to our clinic appointments, 20 minutes to see you, and in those 20 minutes we've got to ask, how are you, how's school, how's life, how's seizures, how's meds, what else can we have a conversation about in 20 minutes. But a big part of what we do is try to educate people around medication and their side effects. There's a really good website called Medicines for Children. Medicines for Children have all the really easy read leaflets that I would always give out in my clinics or tell families to look up, because they're so easy to read. They're not scary, because if you pick up that box and you open that pamphlet and you've got like reams and reams of paper, it's the side effects that you want to know that are the most dangerous ones. Are you going to have an allergic type reaction to something? Are you going to have a rash? Is something going to be really dangerous? So I think that's a really good point. And mental health, I wish we could do more on mental health. I think we fail hugely on.
Oh no, I agree with that. I think the lack of support for mental health and epilepsy is a huge issue. And I think it's something that we need to do more. I mean, at the moment, what we offer from the youth support service side of things is we do one-to-one support and mentoring. So if a young person, either through a professional or a family member, or even the young person themselves, wants to reach out to us, we can offer them like one-to-one sessions. Now, it isn't like formal counselling or mental health support in that sense, because there are other agencies that should be providing that, and if somebody presents as having quite, serious issues in those areas, we would like to send them back to the GP, or we'd look at a referral to other services. But in terms of the support around the emotional well-being and coming to terms with the epilepsy, we do quite a lot of work in our one-to-ones. We don't get to enough people. Obviously we try and reach as many as we can, but we're a very limited team. We're trying to expand, we're trying to get out there, and we can't give everyone a one-to-one, right? Yeah. But we do like short interventions. We try and get those sessions in there, and like a couple of things, give people a space to talk about how they feel around their seizures. Really, really important. Sometimes just talking and venting can be a huge step. Putting people in touch with other young people with epilepsy for our support groups and for our community groups that we run, like both face-to-face and online. We try and do all of that, but we're aware that it's a very small, part of a much bigger problem that we're trying to do. I mean, one thing I'd like to call out in terms of like mental health support and emotional well-being is we've partnered with Shout, and there is a text-based service. If you text 85258 with the word purple, so you text the word purple to 85258, that's a 24-hour text line where you have someone who's trained on the end of the phone, and that word purple lets them know that you have epilepsy.
Oh, amazing.
And we've done a bit of work with them in terms of training their responders on that text line to understand a little bit about seizure types and what people with epilepsy might be going through. Because obviously what I say to the young people I work with is we do the one-to-one sessions, but I'm not there 24 hours a day. If you're having an issue at night or something like that, or during time when we're not available, 85258, text that number, purple, and you can get a little bit of help there. And it's a small thing, but it is something that I think is invaluable, because you're right to call it out. Like there is a lack of support around mental health, and we do want to help that as best we can.
That's amazing. Thank you for sharing that. Thank you.
Really good.
So just on our winding up our podcast for today, what's your takeaway message, Olivia, to anybody that's listening to this who may be struggling, who may be thinking, I don't know what to do anymore, I don't know who to turn to? What would your takeaway message be?
I think I've said this my whole life, ever since I've been diagnosed. Don't let epilepsy define you. You can do whatever you want. And even if you don't do anything at the moment, you can find things to do. But there's no point in like dwelling on it. You know that it is what it is, but it's not the end of the world. You've got plenty of opportunities, and you just have to take advantage of them. And at the end of the day, it's going to make you stronger. You know, I've watched myself get stronger. And yeah, I've witnessed, discrimination, and I've witnessed trauma and whatever, but I just think to myself, this in the future is only going to make me a stronger person. And I think, you've just got to hold your head up high and just carry on the journey, because I watch everyone else around me who does sport and they've not got epilepsy, and I have. And I just think to myself, well, I've got epilepsy and you've not, and I'm still here doing better than you.
Amazing.
You're winning at life, Olivia. Thank you so much. That's really very, very inspirational.
Thank you.
And it's made me feel a little bit emotional. But that's that's really very emotional. You're absolutely right. You're absolutely right. Olivia, Alex, thank you very much for your time today. I have loved this podcast with you guys.
Yeah.
So remember, if you know somebody who needs support, please don't hesitate to reach out to us. Young Epilepsy are here to help you. For more information about epilepsy, please do visit our website, and you can find all the information you need by clicking the link below.
Together we create possible.